Assalamu alaikum. Welcome to Health and Health Issues. I am your host, Hamdy Radwan, and I am so happy to be with you again to discuss issues about your health. We need you to be a healthy Muslim, healthy person, to take care of your health and to deal with things that can reduce your health risk factors that may affect your health on the long run. Today we have a very special program, and I need you to follow up with me attentively because we will address a lot of issues about your neck, your back problems. Pay attention today and come next time also to follow up with us for these back issues. Before I go there, I'd like to present that disclaimer on the screen that these are for your information to know about your back, about your spine, but also we need you to consult with your physician or your physical therapist if you have problems. I will introduce some exercises, some positions that you can use to help your back, your sitting posture, your spine, but also I need you to, if you have back pain, to consult with your physician and with your physical therapist. Again, just a reminder to all of us that the Rasul sallallahu alayhi wasallam told us al-mu'min al-qawi khayrun min al-mu'min al-da'if, al-mu'min al-qawi khayrun min al-mu'min al-da'if, that the strong believer is better in the sight of Allah than a weak one. And the Rasul sallallahu alayhi wasallam also said, inna li badanika alayka haqqa, your body has rights upon you. So let us take care of our body, let's take care of our posture, let's take care of our back, because the back problem is very big problem. Let me give you some statistics that might be frightening somehow, but bear with me. We will help you to go through that so you know about your back. The low back pain is there. 75 to 85% of the population already have low back pain. And the chance that you yourself, you will get back pain in your lifetime, it is very high. It is about 70%. So each one of us will have some sort of low back pain somewhere in their life. And this back pain or back injuries cost us a lot of money at the personal level, at the administration level, and also at the government level. So many people, they lose their work because of low back pain. A lot of people change work because of low back pain. Some of them, they have to modify their positions, their habits, their workload because of low back pain. Aside from the physical stress that the low back pain causes, then from sitting, from the pain that we have, the economy, the cost of the economy is so much on low back pain. And for example, in the United States, we spend up to $50 billion because of low back pain. $50 billion. That's a big number for low back pain problems. And that is, you can say that the direct cost that the cost of going to the physician, to your orthopedic surgeon, or to MRI or CAT scan, all these costs that are 30 to 50 billion dollars. And as much as this amount also for relocating the people that they have low back pain, to relocate them to another job or to get them in the work field again with less back injury. So, and the point here that back pain is very costly, and we need to take care of our back. To do so, I need you to pay attention to the structure that Allah subhanahu wa ta'ala gave it to us, the structure of the back itself. If you look at the next slide, you will look at the spine that the creation of Allah subhanahu jalla wa ala. He created the spine in different segments. We have number of bones on top of each other, vertebrae, and start from your skull, from your head, your neck. We have 7 of them, and then your thoracic spine or your chest area have 12 of these vertebrae, and then the lumbar spine, 5 of them, and then there are some others down there. So if you look at the spine here on the screen, again one more time for me please. This is the up here. So we have the cervical spine and the top portion, and then the thoracic spine going down here, and then this is the lumbar spine. If you look at the back view, if I look at your spine from the back side, I should see the spine straight. Like again, if you present that to me, you look at the screen is all on one line. That straight from up from your neck down to your pelvis. That should be straight. There is no deviation in the curve. This spine is structured in a way to protect your organs. 2 main functions for this spine. One is the protection of the organs around it, and one also for movement, because you move, you bend forward, you get to the side, to the other side by utilizing your spine. The spine is composed of bones on top of each other and also of muscles around it. Your back muscles are part of the support system that support your back. Now, I need you to look at the screen carefully, and because I will explain the curves of your spine. The curves is the structure, the bending of the spine from the top bottom, because if we change that structure, that will cause a lot of changes of the mechanics of the back. The mechanical structure of the back itself is very important, because if we change or deviate from the normal mechanics of the spine, the pain will come in, and we don't know exactly where the pain coming from. It might be you're leaning to one side a little bit more than the other side, and that might be the cause of the problem. And toward maybe few sessions to come, I will be talking to you about the type of shoes that you need to put on your foot, because that might be also the problem. Or how you sit, stand, walk, sleep. All these are things that may affect your spine. So back to the screen, and let me explain this curves for you. We have actually two main curves, and 2 secondary curves. The main curves are the bend forward. It's called the kyphotic posture, where the spine is bent forward, where you find in your thoracic spine and your sacral area. So these are the fetal position. We are bending forward. When we are in the womb of the mother, you're bending forward, and that's called the kyphotic posture. When we start to look up, stand, we develop different curves, and this curve is called secondary curve. Comes after the first curves, and that called the lordotic curve. The lordotic curve is bent backwards. You look at the cervical spine. Some in other areas they pronounce it cervical, but in the United States we call it cervical. So if I'm talking about the same issues, same part of the body, cervical or cervical, it's the top portion or the neck portion of the spine, and that bend forward is lordotic curve, and also the lumbar or the lower part of the spine is the lordotic curve. Most of the brothers and sisters, most of the problems happened in the spine happen because of that changes of the curvature. If we change the curves of the spine, you may be vulnerable to a lot of pain, and it might be also very minimal change, not a big change. You don't have to be like leaning all the way to the side or to the other side to feel the pain, but it might be a little bit to the left or the right, and that may cause the pain at one of the sides. Now, let me show you some of the abnormal curves. The one that we saw first is the normal curves. These are the abnormal curves when we have increased of the curve itself at the thoracic level, The people that they walk and bending forward, their chest is bent forward, we call that kyphosis, or increase the curve of the chest area. Or they are bending backwards with the people that they have a big tummy and the tummy is in front of them, and you have the lordotic curve in the lumbar spine increased, we call that lordosis. So we have the kyphosis at the thoracic level, lordosis at the lumbar level. Both of them, if we have these two, that will change the mechanics of the spine and may lead to a lot of pain, and I will explain that in detail. These are the changes on from the front view. If you look at the patients, if you look at someone bending forward or bending backwards. There is another type of curve that you find the person is tilted to one side this way or tilted to one side this way. It's called that scoliosis. If you look at the screen for a second, the scoliosis is change of the curve from sideways, the sideways of the curve. Let me bring that on the screen. Yes, please, thank you. And this is to the side. So that tilting to the side, the one to your left side is called the scoliosis, and that may cause a lot of pain also in the disfigurement of the spine. These are the normal and abnormal curve of the spine. When we come back, we'll explain other things, other problems on the spine. Till we meet again, I want you to think about your spine, how many vertebrae we have, how many curves we have. Are you really taking care of your spine? We'll see that next time, and please stay healthy, increase your strength of iman and strength of muscles, because we need both of them. May Allah subhanahu wa ta'ala protect all of us. Wassalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to Health and Health Issues. We started last time talking about the spine and spine problems, back pain. Everyone now is complaining of back pain. Wherever I go, when someone asks me where you work, and I tell them I'm a physical therapist, oh, my back hurts, my neck hurts. So I got a lot of that on daily basis. Everybody has these problems. In this program, I would like to educate you about your spine, the structure of the spine, problems of the spine, and to give you some tips how to deal with your back and back problems. Before we start, the disclaimer there on the screen that this is for your information. If you have actual problem, you need to consult your physician or your physical therapist for more advice before you do any of the things that we will raise your awareness with it. Just to raise your awareness, and then you continue with your health, inshallah. Last time we talked about the structure of the spine itself. We have many bones on top of each other, about 33 of them. Some of the cervical spine or the cervical spine, 7, and in your thoracic, 12, in your lumbar, 5, and these are all down there in the sacrum, and the pelvis is connected to the spine itself. Let us look at some of these vertebrae and look at the structure itself, so to have an idea what are these structures that on top of each other. If you look at the screen with me, you will find the vertebra are like, this is one of the vertebrae, this is the body of it, here the body of the vertebrae connected to the posterior portion. So we have anterior, this is the anterior, that means the front part of the spine. The posterior is the back part of it, where you if you put your hand on your back, you will find these spines are coming out, and this is the part of the spine. This vertebrae is on top of each other from all the way up in the neck down to your spine. They are connected with each other. So if you look at this area right here and up here, this is a joint in your spine, basically exactly like the joint in your knee. See, this is a similar joint like your knee joint. So all the problems you will feel, or you will hear about, a lot of people that have knee pain, the knee swells, you have problems with your knee, or some arthritis, arthritic changes, all that happens also in the spine. So you can have it the same way as you have it in the spine. Between these vertebrae, if you help me and get the screen one more time, the vertebral body are on top of each other, and in between them you will find a protector, because we move and jump and run and go from one place to the other, and we need a protection between the bones. So if we look at the screen, please, here are the what you call that shock absorber between each vertebrae, and that's what we call the disc in between the vertebral body. And if you look at the x-ray in the top, see that disc right in here, maintaining a space between the two vertebrae, and around it you'll find nerves are coming. So the nerves are coming out between this nerve. This disc in between the vertebral body is very soft, jelly-like material. When you jump, it absorbs the shock, so that you continuously putting pressure on your spine, and these discs are continuously compressed, and needs to be maintained at certain level to maintain the space between the vertebral body. Now, if the space is like that right here, and the shock absorber that's going up and down, this content of the disc itself, it has a lot of water, fluid, about 85% of it fluid. When we grow older, like 30, actually some started at 20, that water content or the fluid content decrease, and when the fluid content decrease, the space between the vertebral body, between the vertebra decrease itself. So you will get that bones touching somehow each other. And if you imagine that this is the joint in the back, so if this joint should be maintained this way, if the space decrease, that joint will touch each other. And most of the pain on the back comes from that loading of the spine. We load our spine so much, and that's why we have a lot of people complaining of low back pain. I can look at the room around me right now with all the technicians working with us. You'll find most of them are sitting in a posture that is not the correct posture for the spine. I need to go to the next slide, and the next slide, it shows you the nerves coming from one side to the other side. So in the spine, if you look at here, this is your spine all the way down. From each level of the spine, there is a nerve coming, one to the right, one to the left, and these nerves are coming out to feed your arms, your legs, and your other parts of the body. So from the spine itself, which is the main structure, coming branches to branch out to enable you to move, to feel, to move your body, move your system, and that is the structure of the spine itself. These are the nerves. And then these nerves, that if you look at the screen again one more time, you'll find these nerves are distributed all over your body system. So from the top and the cervical area, thoracic area, down to the lumbar, down to your legs, and all these nerves right here that you see are the feeding, and it has two parts: feed back and feed forward. That means you need information comes from your system, from your brain, from your spinal cord, which the spinal cord is the area within the spine itself that had the nerves in it, and it comes out to feed your muscles, and that's called, and this area comes again with sensation from your skin, from your joints. These are feedback to your brain, so it can control your position in space, your movement, all that. All these nerves are coming together. Why I'm saying all of that, and we are in the low back and low back problems, because now recently we discovered that people with low back pain, they may have problems with sensations, with balance, with sitting. Sometimes they have problems with other parts of the system, and that is because of the back problems out and the nerve intactness. The nerves also carry sensations, and the sensations come from different parts of the body, and that's why some people, when they have neck problems, they complain of numbness, tingling, change of sensation of the hand, of some of the fingers, maybe change of the sensation of your foot or other parts. And that's because of the nerves coming in on the sides of the vertebral body out to your arms and to your leg. Now, I need to just clear up some of the myth about the spine, because there are a lot of people talking that said, I have a slip disc and my disc is out. And it's actually the disc will never slip, but you may bulge, that means comes out of the area. The disc is like, if you can get my hand in the screen, the disc is like a circular area around, and this is called the annulus. The annulus is around the vertebral body, and then inside you have the nucleus. The nucleus is jelly-like material inside the disc itself. When we compress the disc, that area inside may come out. It's called bulging or prolapse. So that is the prolapsed disc, but it's not slip disc. The second part, that most of the people, they say, I have a pinched nerve. My nerve is compressed. The pinched nerve actually is the least common problem of the spine. Yes, that most of the spine problems, neck pain and back pain, they have numbness, tingling, but these are the least common problem. Not everyone with back pain or neck pain, they have problems with sensations or pinched nerve. So that don't take, just keep saying that I have a pinched nerve, because it might not be true. There is another myth about the spine, which was practiced before when I was in the school years ago. We used to know that when you have low back pain or your back injured, go and take rest. So a prolonged rest. That they used to say that take rest because this is better for your spine, or sleep on a hard surface. All that has been changed, and we will talk about that in details the next few sessions. Now, when you have low back pain, the best treatment is movement, to move and do more activity, not less activity, not rest, not you increase your activity level, you treat your back problems. This is all the time that I have for today, and I will continue next time clearing some things about the spine, and we will go in details about some exercises, some activities that you can do to help your spine stay healthy. Till we meet you next time, increase your iman, increase your health, take care of your health. And I do remember that I told you at the beginning that we need to drink more water. So let's drink more water. Till next time, I'll see you again. Assalamu alaikum wa rahmatullahi wa barakatuh.